Hello coders, good evening. Today we discuss part 2 general coding guidance. Please like and share, subscribe my channel for new viewers. Okay. So first today total 20 topics are there for the general coding guidance. Let us discuss step by step. So step 1 to look at the code ICD-10. Start with alphabetic index. Look up the main term disease, condition, symptoms or region for visit. Then check any subterms listed under narrow down the diagram. Second, verify the tabular list. Once you find the suggest code, always go to the tabular list. Confirm that the code matches the diagnosis. Check for laterality, right, left, bilateral, specific details, severity, type, see, seven the characters. We use some conditions like injuries. So next, follow the instructional notes. Pay attention notes like includes, excludes, code first, use additional code, disappear both section and guide correct code. So what is the important points is this? Always use both section. If the alphabetic index helps you find the code, but the tabular list ensures the correct and complete. Alphabetic index may not show the full code. Some codes need extra characters that are only confirmed to the tabular list. So dash or this type of symbol is meaning if your code ends a dash or alphabetic index, more characters are required. Even without dash, still check the tabular list ensure no extra characters like from the characters are needed. So, for example, acute appendicitis. First, look the alphabetic index, find the main term appendicitis, then look for subterm acute. You will find the suggest code like K35 point dash. So the dash means the code is not complete. So go to the table list, look up the category K35 acute appendicitis. Now you will see more specific codes such as K35.80 unspecified acute appendicitis, K35.18 other acute appendicitis. So choose the most specific code. If documentation does not specify details, use K35.80. If more details are given, choose more specific code. Step 4 check notes. Look for includes, excludes, any needed for additional code, whether seventh character is required, not included here. So final code is selected K35.80. So what is that this for this heading for learning? First, alphabetic index helps to find the code category. Tabular list helps to finalize the complete correct code. For example, diabetes coding. So type 2 diabetes mellitus with diabetic neuropathy. So alphabetic index, look up the main term diabetes. Subterm type 2 with neuropathy. So you will find code like E11.40. Tabular list verification category E11 type 2 diabetes mellitus. Find E11.40 type 2 diabetes mellitus with diabetic neuropathy unspecified. Check out ICD-10 uses the combination codes diabetes with complication together. Check if a more specific neuropathy is documented. Final code 11.40. So what is the key point is that diabetes could often combine the condition plus complication in the one code. So second example fracture. So fracture shaft of right femur initial encounter. So first alphabetic index main term fracture. Subterm femur shaft right. So suggest the code S72.30 dash. Dash means the more characters needed. So tabular list go to S72 fracture of femur, S72.301 unspecified fracture, shaft of right femur. Add seventh character. For fracture, seventh character is required. A is initial encounter, D is subsequent encounter, S is sequel. So final code becomes S72.301A. So what is a key point means in surgery codes usually needed seventh character. So always check the laterality left and right encounter type. What is the quick summary in this heading? Diabetes with combination code, fracture needs seventh character. So level of detail code in second heading, use the most specific code is positive. When assigning diagnosis codes, always choose the code with highest number of the characters available. The code must match the maximum level of detail documented the patient's medical record. So, in simple term, what is the meaning of this level of detail coding? More detail, more accurate code. So, structure of ICD-10 CM codes. ICD-10 same diagnosis code can contain 3 characters, 4, 5, 6, and 7 characters. So each additional character provides more specific clinical information. So meaning of 3 character code, a 3 character code presents category heading of disease or condition. Many categories are subdivided into more detailed codes using extra characters. So use 3 character code only when the category is not further subdivided. So requirement of the code to full length, the diagnosis code is considered invalid if it is not coded to require number of characters or it requires 7 characters missing. For example, if a condition requires 5 characters, you must be report all five. If a 7 characters extension applies, it must be included. So why this matter means using the complete specific code ensures accurate clinical documentation, proper billing and reimbursement, correct statistical healthcare reporting, compliance with coding guidelines. So, what is the key rule for this? Remember, never stop coding at fewer characters if more specific characters are available. So, third heading codes for the code from A00.0, T88.9, Z99.9 user is what is the meaning of this code? Purpose of this code the codes are following ICD-10 range to identify the reason for the patient healthcare encounter for visit. So diagnosis, symptoms, medical conditions, problems or complaints, other reasons for receiving care. These codes explain why the patient is being seen. So code range is what they represent A00.02 T88.9 used for this category but codes for diagnosis, disease, injuries, poisonings, external causes, and complications. So, example for this category is infectious disease, chronic illness, injuries, and trauma. So, Z series this is not due to illness or injury, but healthcare services such as routine checkups, screening examination, follow-up visits, vaccination, personal or family medical history of factors. So, these are often Z codes. U codes is specially purpose for including emerging disease, public health emergency, newly identified condition, for example, pandemic related condition. Recently, we see coronavirus. That's also come in this category. So, what is the key rule for this course? At least one appropriate code from this range must be assigned. Clearly describe the reason for the encounter. So, simple memory tip is that A to T, disease or injuries, Z series, health service and special situation, U, special and emergency classification. So, fourth heading, signs and symptoms. When can symptoms code be used? Code that describes signs and symptoms can be reported when definite confirmed diagnosis has not yet been established by provider. If the doctor has not confirmed a disease, you may code patient symptoms instead. For example, patient complaint chest pain. Doctor has not confirmed the heart disease yet, so code symptom chest pain. But if later diagnosis confirm myocardial infarction, code the diagnosis, not the symptom, unless instructed otherwise. So when symptoms codes are found, most symptom codes are located in chapter 8. We discuss for next classes in this chapter. So in chapter 8, symptoms, signs, and abnormal clinical laboratory findings not elsewhere classified. The core range is R00.02 or 99. These codes are include pain, fever, dizziness, abnormal test results, general symptoms without confirmed cause. So note, not all symptoms codes in chapter 18. Some appear in other chapters also. So important coding rule use symptoms code when no confirmed diagnosis exists. Then provided documents only for symptoms are compliant. Do not report symptoms code when a confirmed condition fully explains the symptoms unless there is allow additional coding. So this rule connects to section signs and symptoms specified codes. Quick memory trick. What is this? No diagnosis code symptom. Confirmed diagnosis code for condition. This is the simple rule. So conditions that are integral part of the disease process. So main rule, signs and symptoms that are normally occur as a part of disease should not be coded separately. So, if a symptom routinely associated with confirmed disease, it is considered as included in the disease itself. What is the integral part means? Integral part means the symptom is commonly expected with that condition. It is automatically assumed when the disease is diagnosed. So, coding it again would be duplicate reporting. For example, diagnosis of influenza, symptoms are fever, cough, sore throat. Code influenza only, do not code fever, cough, because they are typically symptoms of influenza. For example, two diagnosis acute appendicitis, abdominal pain. Code appendicitis only. Do not code abdominal pain separately. Exception. You may assign additional symptom score if the classification is specifically instructs you to. So, examples of include symptoms that are not routinely associated, symptoms that are require separate clinical attention, official ICD-10 instruction directing additional coding. So, why this rule exists? It helps to avoid the duplicate coding, maintain accurate medical data, prevent incorrect billing. So, what is the quick about it means? A typical symptoms already included do not code separate. So, sixth heading conditions that are not an integral part of the disease process. So main rule signs and symptoms that are not routinely associated with the disease process should be coded separately when they are present. If a symptom is not normally expected with the diagnosis condition, assign an additional code for it. So, meaning of the not integral, the condition or symptoms is not integral when it is uncommon for the disease or it requires separate evaluation or treatment or it adds important clinical information about the patient. So, example, diagnosis otis media, ear infection, additional symptom vomiting. Code otis media, vomiting, separate code. Reason, vomiting is not routinely part of ear infection. Next example two, diagnosis hypertension, additional symptoms, severe dizziness documented and treated. So both condition may be correlated because dizziness and not an integral symptoms of hypertension. So comparison with previous guidelines coding rule, integral symptoms, guidelines quickly, do not code separately. Not integral symptom, guidelines is code separately. So why this should matter means coding additional not integral symptoms shows full patient condition, support medical necessity, improve documentation accuracy. So, if quickly remember for this unusual symptoms, code it. Expected symptom, do not code. So, multiple coding for single condition. So, some medical conditions cannot be completely described using only one code. So, therefore, more than one ICD-10 code may be required for fully explain the cause of the condition, the disease itself, complication or effects on different body systems. So, etiology manifestation convention. Certain disease involve etiology, underlying cause, manifestation, condition result from the cause. So, two codes are required. Underlying the condition, this is code first, manifestation, secondary code. Use additional code for note. A secondary code should be added to give more details about the condition. It found the tabular list, not always an etiology manifestation pair, added if information is known. For example, guideline for infections where the organism is not included main code. Assign the infection code first. I add organism code from B95, Streptococcus, Staphylococcus, Enterococcus. B96, other bacteria. The infection code will be included, use additional code infection. The code first node means if an underlying condition exists, the underlying cause must be sequenced first. Other matters, example, disease caused by another condition. So code underlying disease first. So code, if applicable, any causal condition first, meaning should be the code can be used as a principal diagnosis if cause unknown. This cause is known, code causal condition is first. For example, sequencing rule, cause of known, cause first. Cause of unknown, currently condition may be first. So other situation requiring the multiple codes, sequela, complications, obstetric condition. So each has own specific guidelines. Why multiple code is important means it helps to fully describe the complex conditions, shows the relationship between the disease, improve accuracy or coding building. So use additional code, add another code. Code first, underline the condition first. Code casual condition first, cause first is known. So simple rule. One condition may need multiple codes to tell the complete clinical story. That's it. Next, very, very important in your interview also to get the question for acute chronic conditions. So acute and chronic condition. When the same condition is documented as both accurate, acute or subacute and chronic. So and separate code exists with alphabetic index, same in identification level, indication level. Assign both codes. So sequence the acute or subacute condition first, followed the chronic condition. So meaning term acute, sudden onset, short duration, often severe. Subacute, between the acute and chronic. Between the acute and chronic. Chronic, long lasting or persistent condition. So coding steps, check the alphabetic index, confirm the separate codes exist for acute and chronic forms, assign both codes, sequence acute first, chronic. For example, provide documentation, acute and chronic tonsillitis. Coding, acute tonsillitis first listed, chronic tonsillitis second. So why acute codes come first? Usually requires immediate treatment, represent the current active problem. So what is the important note? If only one combination code exists for both acute and chronic, use the single combination code only. Do not assign two codes for in the combination code purpose. So acute plus chronic code together, code both. Acute first, chronic second. So what is a combination code? Means a combination code is a single ICD-10 that used to classify the more than one clinical concept at the same time. It may request two diagnoses or a diagnosis plus manifestation secondary condition or a diagnosis complication. One code tells the complete clinical story. So types of combination code, two diagnoses in one code. Example, disease and related condition include one code. Diagnosis with manifestation, example, diabetes with neuropathy, one code includes both conditions. So, diagnosis with complication, example, condition with associated complication already built in the code. So, how to identify the combination codes? You recognize them checking subterms in alphabetic index, reading inclusion notes, reading exclusion notes in the table list. So main coding rule, use only combination code when it fully describes all documented conditions. Do not assign multiple separate codes if combination code is already exist and covers everything. When additional codes is needed, assign extra secondary code only when the combination code does not provide enough specificity or the manifestation complication needs more detail. For example, combination code only. Diagnosis, type 2 diabetes with kidney complication. Use one combination code that includes both conditions. Do not code diabetes and kidney disease separately, include in one code. For example, combination code, additional code. Use combination code does not specify exact complication. Combination code, additional secondary code for specificity. Why combination code exists? They help to the reduce duplicating code, improve the accuracy, simplify the documentation, ensure the correct reimbursement. So this is what quick memory for one code covers all. So use one code. Not enough detail, add another code. That's it. Then heading Sequela. Let effect explain what is Sequela means. A sequela it is a residual condition that remains after the acute phase of an illness or injury has ended. So it is lasting effect caused by the previous disease or injury. So, important point, there is no time limit for using Sequela code. The residual effect may appear immediately after illness, example stroke, weakness, or month of year. Also, example complication from an old injury. Examples of sequela. Scare formation after the burn, deviated septum due to old nasal fracture, infertility caused by previous tuberculosis infection, paralysis following a stroke. So, general coding rule: two codes are required. Sequela code used only needs two codes. Sequencer follows. First code, the correct residual condition problem now. So, the current residual condition problem now. Second code, the sequel late effect code showing the the original cause. So first code, the current residual condition, the problem of the patient has now. Second code, the sequel late effect code showing the original cause. For example, patient has scar from previous one. So coding order, first the scar, current condition, burn sequel code cause. So, important to do not code acute condition. Very, very important. The code for original acute illness or injury is never used together with sequela code. Reason, the acute phase are already ended. So, exception. Sometimes the sequela code already include the manifestation or tabular list instructs a different sequence. So, in these cases, follow the instruction listed in the tabular list. So, special sections mentioned additional rules exist for sequela of cerebrovascular disease, strokes, pregnancy and childbirth complications, injury codes using 7th character chapter 19. So, current problem first, old cause second. The cause rule for the sequela. So, simple formula. Sequela coding is equal to residual condition plus cause sequela code. Okay. 11th heading. Impending or threatened condition. What does impending or threatened means? These terms are indicated that condition that may occur soon or is likely to develop but may or may not actually happen. For example, threatened abortion, impending respiratory failure. So, coding rule at time of discharge, coding depends upon whether the condition actually occurs. So, if the condition is did occur, code it has a confirmed diagnosis. Example provided document. So impending myocardial infarction and the patient lateral developed it. So code myocardial infarction is confirmed. So if condition did not occur, follow these steps. Check the alphabetic index. Look for subentry under conditions for impending or threatened. Also check main terms impending threatened. Step 2 subterm exist. Assign the specific code listed. So, for example, threatened abortion has its own ICD-10 code. So, step 3, subterm not exist. Do not code threatened condition. Instead, the code only existing underlying conditions and symptoms. So, situation what the code means. Condition is occurred. Code confirm diagnosis. Did not occur. Subterm exist. Use impending and threatened code. Did not occur, no subterm. Code underlying the condition. This is the main important table for this. So why this will exist means never actually developed where only suspect the risk. So if it happened, code it. Did not happen, check the index. No listening, don't code it. That's it. Okay. Next, reporting the same diagnosis code more than once. Each unique ICD-10 same diagnosis code can be reported only once per encounter. Even if the condition occurs in more than one location, the same code should not be repeated unless different code exists. So that is means a diagnosis code represents condition that entire visit. You do not assign the same code multiple times for same patient encounter. Bilateral condition. This rule especially applies when a code affects both sides of the body. If not, laterality specific code exists. So report the diagnosis code only one. So for example, condition bilateral ear infection. If ICD-10 provides only one code without right-left distinction, report the code one time only. Do not report the twice, once of each ear. So when multiple codes are allowed means separate codes exist right and left side laterally available, or the patient has a different condition even similar. So next example, right knee osteoarthritis one code, left knee arthritis different laterality code. So both codes may be reported. Why this rule exists? It prevents duplicate reporting, billing errors, inflated disease counts in record. For this quick memory tip, same code report once per week. Third, laterality in HLTNCM. Simple explanation for this. Laterality means identify the which side of the body, right, left, bilateral, both side, unspecified side. When the codes are included laterality, some ICD-10 CMs already specify this code. Always choose right side code for right document, left side code is left is documented. Bilateral codes if both sides are affected. If no bilateral codes, when a condition affect both sides, but no bilateral code is available, assign two codes, one of the right, one of the left. If sites is not documented, if medical records do not mention the site, use unspecified site code. However, unspecified code should be rarely used. Try to obtain clarification first. So bilateral condition treated in separate encounters. First encounter, if the patient still has disease on both sides, assign the bilateral code, even if only one side is treated during the visit. Second encounter, after one side has already been successfully treated, condition exists only on the remaining side. So don't assign bilateral code, assign unilateral code for the side still affected. So, for example, cataract surgery done one eye at a time. First surgery bilateral cataract code, second surgery left or right cataract code only. Exception if treatment first side did not completely resolve the condition, continue using bilateral code, which is the exception. So, laterality from other documentation. If the provider did not state laterality, you may use the documentation from nurses, imaging reports, other physicians. So, conflicting the documentation, if records disagree about the affected site, query the provider for clarification. Key coding rule always code the highest specificity possible. Avoid unspecified laterality whenever clarification can be obtained. Documentation by clinician after the patient's provider. Documentation by the clinicians other than patient's provider. General role. ICD-10 CM clinically normally assigned based on the documentation from the patient provider, meaning physician or qualified healthcare practitioner responsible for the diagnosis for the patient, who are other clinicians. These are healthcare professionals allowed to document official medical record according to the hospital policy and regulations such as nurses, dietitians, ENT, therapists, other licensed clinical staff. So exception when the code may use documentation for other clinicians, code ascent can be used on non-provided documentation only for the following: body mass index, BMI, depth of non-pressure chronic ulcer, pressure ulcer stage, coma scale, NIH stroke scale, NIHSS, social determination of health, SDOH, chapter 21, laterality, blood alcohol level, under immunization status, firearm injury index. Examples are this. Okay. Even though these details may come from other clinicians, The related diagnosis must be documented the type of provider. Example, dietitian document BMI allowed, but provider must be document obesity overweight. Nurse document pressure ulcer stage allowed, but provider must be diagnosed with pressure ulcer. EMT document come the scale allowed, but provider must be diagnosed with brain injury or stroke. So if documentation conflicts, with differential claims but document conflicting information, query the patient provider for clarification. Secondary diagnosis rule. The following codes may only reported secondary diagnosis BMI, coma, NSA, stroke, blood alcohol, social information of health, underlying imaging status. Never assign these are principal diagnoses. Coding tip. Provider documentation the diagnosis. Other clinicians may document the supporting measurements of detail. So, 15 syndrome. Syndromes are ICD-10 coding guidelines. What is a syndrome? A syndrome is a group of signs and symptoms or conditions that are occur together and characterize a specific disorder. For example, Down syndrome, post-laminectomy syndrome, irritable bowel syndrome. Follow up the alphabetic index first. When coding a syndrome, always check the alphabetic index. If specific code exists for the syndrome, assign that code. The index instruction take priority if no specific syndrome code exists. If the alphabetic index does not provide a single code, assign code for each documented manifestation of the syndrome. So, code all signs and symptoms or conditions documented by the provider. Coding additional manifestation, you may assign additional codes when the manifestations are integral, not routinely part of syndrome, and then syndrome does not have a unique single code covering all conditions. For example, unique code exists, Down syndrome. Assign the specific Down syndrome code only. No need to code individual features unless separately treated. So no unique code. Provider documents chronic pain syndrome, muscle weakness, fatigue. If no single code describes the syndrome. So code chronic pain, muscle weakness, fatigue. Key coding rule this means alphabetic index guidance come first. If no syndrome codes, code the manifestation. Documentation of the complication of care. Documentation of the complication of care basic rule. Assignment of a complication code depends on provided documentation showing a relationship between the medical care or procedure and the resulting condition. Not every post-procedure condition is a complication. A condition occurring during treatment or after surgery does not automatically mean it is complication. There must be a cause and effect relationship, clinical significance. Cause and effect relationship is required. The provided documentation must be indicate that the condition result from the care or procedure. Example, post-operative injection due to surgery, accidental puncture during procedure. So, provider does not need to use the word complication. The provider does not have literally write complication. The document shows that condition changed the surgery, require additional treatment, altered patient management. A complication code may still be assigned. For example, operator report states unexpected bleeding require a repair. So complication code is appropriate. Applies across all ICD-10 chapters. This rule applies to all complication codes, no matter which ICD-10 that appears in. So clinical significance is required. The condition must be meaningful, immediate, medically, such as requiring treatment, monitoring, extend hospitalization, additional procedure, minor or essential incidental findings are not complications. So, when is unclear. If the relationship between treatment and condition is uncertain, query the provider for clarification before coding. Key coding principle. Timing alone does not equal complication. Document must show cost and clinical significance. Borderline diagnosis. Borderline diagnosis for ICD-10 guidelines. What is borderline diagnosis? A borderline diagnosis means The condition is between normal and abnormal, but the provider identifies it as a clinical diagnosis. Example, borderline hypertension, borderline diabetes. Code the borderline diagnosis as confirmed. If the provider documentation borderline diagnosis at discharge, code it is confirmed diagnosis. Treat the same as definitive diagnosis. When ICD-10 has a specific borderline code, some conditions have a specific alphabetic index entry for borderline. Use specific borderline code. Example, borderline diabetes use the specific ICD-10 borderline diabetes code. Borderline uncertain diagnosis. Borderline diagnoses are not considered as uncertain diagnosis like probable, suspected, possible, ruled out. Therefore, some coding rules applies to inpatient, outpatient, no setting difference. So, when documentation is unclear, if it is not clear, then the condition is truly borderline. Query the provider for clarification. Or the coding rule is mean borderline diagnosis code as confirmed diagnosis. 18 heading use of signs and symptoms unspecified code. Basic principle signs and symptom codes or unspecified codes are acceptable and sometimes necessity in ICT-NCM condition. Coding must reflect what is known at the time of the encounter. So code to the highest level certainty. Each healthcare encounter should be coded based on the available documentation, clinical information known during the visit. Use specific diagnosis code when support to the documentation. When to use signs and symptom codes if a definitive diagnosis is not established by the end of the encounter, report signs and symptoms instead. So example chest pain not confirmed diagnosis, fever, abdominal pain, appropriate until the confirmed diagnosis is made. So when to use unspecified codes, use unspecified code when a diagnosis is known, but details needed a more specific code are unavailable. Example pneumonia is diagnosed, type of organ is not identified. So assign unspecified pneumonia code. So unspecified codes are acceptable. Unexpected, unspecified codes should be used when they most accurately describe the patient condition, reflect available medical record documentation. They are not incorrect coding when information is limited. What code should not to do? Do not assign more specific code without documentation support. Do not assume clinical details. Do not perform the ex- accept, expect unnecessary testing just to obtain a specific code. So, importance of the documentation. Accurate coding depends on the complete provider documents, full review of entire medical record, collaboration between provider and coder. So, key coding rule: code what is known, not unspecified withdrawal. So, code what is known, not what is suspected without documentation. So, coding healthcare and in hurricane aftermath. Use external cause or mobility cause. Coding the healthcare endpoint hurricane aftermath. What is the purpose? When injuries occur, hurricane ICD-10 requires additional coding to explain how the injury happened. Assign the external cause of the mobility code. Use external cause of the cause to identify cause of injury. Related hurricane. These codes are describe cause of injury, hurricane related event, intent, accidental result, self-harm, etc. Place of occurrence, activity at time of injury, person status, civilian, military, etc. So, external cause codes are supplemental. External cause codes provide additional information or never the principal diagnosis or first listed diagnosis. So, the injury diagnosis must be always first. Correct sequencing injury code, external causes code. So, when not to use external causes codes, do not assign external causes code when patient is treated as a medical condition only. No injury, poisoning, or adverse effects exist. Example, hypertension medication refill after hurricane. So, no external cause code. Assign for every treatment encounter, external cause code should be reported at each encounter for treatment of the injury. So, applicable for all healthcare settings, these codes may be used in hospitals, clinics, emergency departments, temporary disorder medical sites, any location, whether licensed healthcare professional provide care. So, key the coding rule. Injury first, external cause code second. So, second shading 9B, 19B, sequencing external cause for mobility codes, hurricane aftermath. Sequencing external cause code, priority the electromagnetic event code, codes for catastrophic events such as hurricane like priority over the external cause code. Hurricane codes are sequenced before other external cause codes. Exception higher priority than hurricane, child abuse, adult abuse, terrorism. Assign multiple external cause codes. Use as many external cause codes as needed to fully explain how the injury occurred. Capture all contribution causes. Example scenario patient injured when building collapsed during the hurricane. Coding order injury code, hurricane external cause code, first external cause, building collapse external cause code. Injuries directly caused by the hurricane. For injuries directly related to the hurricane, sequence injury diagnosis code X37.0 hurricane with correct 7 factor, other applicable external code. So special flooding rules use 37.0 hurricane when injury result from flooding caused by hurricane damage, levee breaking due to hurricane. So use X38 flood when injury results flooding directly from the storm itself. So when not use the X36.0, X36.0 collapse of a dam or man-made structure should not be used when collapse is caused by hurricane. So this code only used for collapse due to earth surface movement, example landslides, earth shift, not storm surge for hurricane effects. So key sequencing rule, injury, hurricane code, other external cause code. So 19C, other external causes for mobility causes issue hurricane aftermath. Other external cause coding issues. This section explains how to code injuries occurring during the hurricane situation, but not always caused directly by the hurricane. So, injuries not directly caused by the hurricane. If injury happened during evacuation or disaster circumstances, but is not caused by the hurricane itself. Assign external assign codes describing the actual cause of injury. Do not assign Hurricane Code 37.0. Example, evacuate involved a motor vehicle accident. So injury caused by the car crash, not hurricane. So code injury code, motor vehicle accident code, external cause code. So do not use the hurricane code. When cause is unclear. So if documentation does not clearly state whether the injury resulted from the hurricane, assume the injury is hurricane related. So assign 37.0 hurricane and any other applicable external code, cause codes. Other possible external cause codes along with hurricane code, additional environmental exposure codes may be used when applicable. X30 exposure of the excessive natural heat. X31 exposure to excessive natural cold. X38 flood. So use multiple codes when needed fully explain the event. So coding rule code the root cause of injury. Do not use hurricane code if injury is unrelated. If uncertain, assume hurricane is involvement and assign K37.0. So 19D use of jet code hurricane aftermath. The use of jet codes other regions healthcare encounters. Purpose of jet code. Jet codes are used to explain why the patient receiving healthcare service when even when no injury or illness present. So provide additional information about the patient's situation during the disaster such as hurricane. When the when to use jet code, jet codes are maybe assigned to explain reason for visit. describe describe social circumstances, identify environmental or access problem, document transfers between facilities, provide additional encounter details. So use jet codes along with the diagnosis or external causes code when appropriate. So jet codes jet codes may be principal or secondary. So depending on the circumstances, jet codes may be principal first listed diagnosis, secondary diagnosis, either principal or secondary. Always follow ICD-10 guidelines for sequencing. Common jet codes used after hurricane, housing social condition, Jet 59 homelessness, Jet 59.1 inadequate housing, Jet 59.5 extreme poverty. So healthcare access issues, Jet 75.1. These are the some codes. So list is not all inclusive. Other jet codes may also be applied based on the documentation, assigning as many jet codes are needed to fully describe the encounter. Limited patient history during disaster. After hurricane, patient information may be incomplete. Use any available documentation to assign external cause code jet code. So key coding rule. Jet codes help explain the patient's circumstances, not just the disease or injury. So multiple sites coding last heading. Multiple site coding ICD-10 guidelines definition of multiple ICD-10 multiple means the condition involve two or more anatomical sites. So follow the chapter specific guidelines first. ICD-10 chapters contain special instructions for coding multiple sites. Always follow those chapter specific rules when available. When no chapter specific guidance exists, if there is no special instruction, assign the separate code for each document set. Example, provide a document infection right arm left click. Assign individual codes of the site. So when specific sites are not documented, the documentation state multiple sites but does not identify the location. Assign the codes multiple sites. Example scenarios, site documented cellulitis of arm and leg. Code each site separately. Sites not specified. Cellulitis involved in multiple areas. Use multiple codes. So, key coding rule documentation site code individually. Sites unknown use multiple sites. That's it for this today class. General coding guidelines. Next, part 3, very, very important class for next class. So, thank you for listening this class. Like, share, subscribe my channel and share to your friends who need this ICD coding for in depth. Okay, thank you.